Welcome to 10 Daily Medical Questions. Let's tackle 10 quick questions. Test your skills and learn something new every day. 10 mixed questions from various medical fields. Question 1. A 23-year-old woman with type 1 diabetes presents with nausea, vomiting and abdominal pain for the last 2 days. She has been feeling increasingly fatigued and confused. On examination, her blood pressure is 95 to 60 mm of mercury, heart rate 120 per minute, respiratory rate 28 per minute, and her breath has a fruity odor. Arterial blood gas shows pH 7.2 and bicarbonate 12 milliequivalents per liter, and blood glucose is 450 mg per deciliter. What is the most likely diagnosis and how should this condition be treated? Diagnosis: diabetic ketoacidosis. Treatment: IV fluids, insulin infusion, potassium replacement if potassium is less than 5.2 milliequivalents per liter, bicarbonate only if pH is less than 6.9. Monitor anion gap and transition to subcutaneous insulin when resolved. Here is an easy way to remember DKA. DKA is deadly. D for dehydration, K for ketones, A for acidosis. Spot the signs early. DKA is a medical emergency. Interesting fact: the fruity breath odor is due to acetone, a ketone body. Question 2. A 45-year-old woman presents with progressive muscle weakness, especially in the evening. She reports difficulty chewing food and occasional diplopia. Ice pack test is positive. What is the most likely diagnosis and how should this condition be treated? Answer: diagnosis is myasthenia gravis. Treatment: first line pyridostigmine, if severe corticosteroids, IVIG or plasmapheresis. Consider thymectomy in case of thymoma. Here is a simple way to remember myasthenia gravis. Myasthenia gravis, muscle gets weak. It's an autoimmune disease where antibodies block nerve signals, causing muscle weakness, especially in the eyes, face, and throat. Quick and easy, muscle gets weak. Interesting fact: the ice pack test temporarily improves symptoms by inhibiting acetylcholinesterase degradation. Question 3. A 60-year-old male with hypertension and hyperlipidemia presents with crushing substernal chest pain radiating to the left arm for 45 minutes. ECG shows ST elevations in lead, 2, 3 and AVF. What is the most likely diagnosis and how should this condition be treated? Answer: diagnosis: inferior STEMI, right coronary artery occlusion. Treatment: let's break down the treatment of heart attack quick and simple. Immediate: remember MONA, morphine, oxygen, nitrates and aspirin 300 mg. Pre-perfusion PCI within 90 minutes is preferred, or thrombolysis if PC is unavailable. Long-term: dual antiplatelet therapy, aspirin plus P2Y12 inhibitor, beta blocker, ACE inhibitor and statin. Fast action saves life. Here is a quick mnemonic for heart attack treatment: MONA BASH, morphine, oxygen, nitrates, aspirin. Beta blockers, ACE inhibitors, statins and heparin. Fast to remember, crucial to save lives. Interesting fact: inferior MI can cause bradycardia due to vagal stimulation. Question 4. A 35-year-old woman on oral contraceptives presents with sudden onset diuretic chest pain and dyspnea. She recently had a long haul flight. Her heart rate is 110 per minute and SpO2 is 89%. What is the most likely diagnosis and how should this condition be treated? Answer. Diagnosis: pulmonary embolism. Treatment: anticoagulation with heparin. If hemodynamically unstable, thrombolysis with TPA. DVT prophylaxis in high-risk patients. Remember, PE triggers the PERC rule: pregnancy, estrogen, recent surgery and cancer. Interesting fact: a classic ECG finding is S1Q3T3 pattern, but it's seen in only about 20% of cases. Question 5. A 50-year-old male with a history of alcohol abuse presents with severe epigastric pain radiating to the back, nausea and vomiting. Serum lipase is 5 times the upper limit of normal. What is the most likely diagnosis and how should this condition be treated? Answer. Diagnosis: acute pancreatitis, most likely due to alcohol. Treatment: supportive care, IV fluids. NPO stands for nil per os, meaning nothing by mouth. Pain management with opioids. Address the cause. Stop alcohol. Remove gallstone if present. Here is the easy way to remember the cause of pancreatitis. Get smashed. Gallstones, ethanol, trauma, steroids, mumps, autoimmune, scorpion sting, hypercalcemia, ERCP and drugs. Interesting fact: Cullen sign, periumbilical ecchymosis and Gray Turner sign, flank ecchymosis indicate severe hemorrhagic pancreatitis. Question 6. A 19-year-old college student presents with fever, headache, neck stiffness and photophobia. Kernig and Rudensky signs are positive. What is the most likely diagnosis and how should this condition be treated? Answer. Diagnosis: bacterial meningitis. Treatment: empirical antibiotics. Dexamethasone before or with first antibiotic dose. Post-exposure prophylaxis for contacts. A quick mnemonic to meningitis treatment: Van fights meningitis, vancomycin plus ceftriaxone. Interesting fact: meningococcal meningitis can present with a petechial rash due to DIC. Question 7. A 42-year-old woman presents with morning stiffness lasting over an hour, swelling of MCP and PIP joints bilaterally. What is the most likely diagnosis and how should this condition be treated? Answer. Diagnosis: rheumatoid arthritis. Treatment: first line methotrexate. Adjunct: NSAIDs for symptom relief, glucocorticoids for flare. Biologic like TNF inhibitors if severe. Here is a quick way to remember rheumatoid arthritis. Rheumatoid equals morning rigid hands. Stiffness is worsened in the morning and lasts over an hour. Interesting fact: smoking is a strong risk factor for rheumatoid arthritis. Question 8. A 67-year-old man with sepsis develops oliguria and rising creatinine levels. Urinary sodium is low. What is the most likely diagnosis and how should this condition be treated? Answer: diagnosis: prerenal acute kidney injury. Treatment: IV fluids. Address underlying sepsis with antibiotics. Question 9. A 30-year-old male develops painful oral ulcers, conjunctivitis, and widespread skin rash with blisters 3 days after starting allopurinol. What is the most likely diagnosis and how should this condition be treated? Answer: diagnosis: Stevens-Johnson syndrome. Treatment: stop offending drug. Supportive care: IV fluids, wound care, and pain control. Interesting fact: SJS involves less than 10% of the body surface area, while 10 involves more than 30%. Question 10. A 28-year-old woman with heavy menstrual periods presents with fatigue and pallor. CBC shows low HB and microcytic hyperchromic RBCs. What is the most likely diagnosis and how should this condition be treated? Answer: diagnosis: iron deficiency anemia. Treatment: oral iron supplementation and address the cause. Conclusion: takeaway message: always think of common diagnosis first before considering rare conditions. Early diagnosis saves life, especially in emergencies like STEMI and PE. Always treat the underlying cause to prevent recurrence. So, that's all for today's 10 daily medical questions. How did you do? Let's know in the comments. Don't forget to like, share and subscribe.